Well, this week is Mental Illness Awareness Week, and the UC Davis Fire Chief is sharing his personal experience on social media.
Nathan Trauernicht joins us now live to talk more about this. So thank you so much for coming forward and being brave enough to tell this story. Tell us a little bit about this diagnosis that you've had.
So I've had anxiety and depression most of my life. Growing up, a lot of times we didn't necessarily have the words for it. We just knew that maybe we were sad. In my case, anxiety in particular felt like it had invaded just about every part of my life. And it wasn't until I got into my 30s and 40s that I was able to start putting words to these feelings and learning that I wasn't alone, and that in particular in my profession, there were a lot of people who were struggling with some of these same things.
Yeah, it is nice now in this generation. I think we have a lot of terms, and we know the names of a lot of things that we didn't necessarily know when we were growing up. I mean, the younger kids definitely have that in their favor because it's talked about so much more. Talk about the challenges of being a first responder on top of all of that and how it affects mental health.
Absolutely. I mean, we all develop coping mechanisms to help with daily life. And for first responders, we develop some that are good and some that probably aren't as healthy. Probably one of the biggest things is that in a recent study, they found that 80% of firefighters said that they felt like asking for help would make them seem weak or unfit for duty. And that's something that we really, just like with the general population, we have to break down the stigma. We have to be able to have a conversation about mental health and sharing our lived experiences, because in doing that, we're learning how to care about ourselves, and also we can help support each other. We obviously see a lot of really challenging and traumatic things that are put in stressful situations, and if we aren't listening to ourselves and to our coworkers, unfortunately, bad things can happen to us.
What are you trying to accomplish here? What really is the goal behind you going public about this, and what do you hope comes out of it?
What I hope comes out of it is highlighting the need for an elevated and continuous conversation about things like depression, anxiety, PTSD, bipolar and personality disorders that will help us, better connect to each other, better navigate to resources, and make it a part of a normalized conversation so that we can give people the support and help they need before a crisis happens.
Well, I think you shed a lot of light on this, and I hope that all first responders watching this right now, or maybe you know someone who's a first responder, I can see why it would be hard for you guys to come forward, because we see you as heroes, we call you heroes, and so you don't want to seem like, you're not strong and a hero, but I'm definitely glad that you're leading by example, Chief, and talking about this, because maybe it will help other people.
Absolutely, and a reminder that it's okay to not be okay. And there's a lot of us who have challenges that are in this together.
And you're still going to be our heroes. Chief, thank you so much for your time. We appreciate it.
Thank you.
And we want to share this information with you. If you know someone who maybe needs help, or if you need help, you can call the National Suicide Prevention Lifeline. The number is 1-800-273-8255, 1-800-273-8255. Maybe just take a picture of this number on the screen so you have it. It is open and available to you 24 hours a day, 7 days a week.